I call my mom almost every morning when I leave. I work night shift, so I leave work and I call my mom, and sometimes I call her saying, "Yay, this awesome thing happened. This patient left the ICU, or this patient did well." And sometimes something tragic happens, and during the pandemic there were a lot of those times that were a little bit harder for me to swallow, and Mom would always help me work through it. She has a good perspective. She has a background in critical care in the NICU and also in ethics. So of course there's all kinds of ethical dilemmas that happen in the hospital, and she would just help me work through them and help me understand what's within my control and what's not within my control, and just always make me feel better because she gets it.
Well, I tried first to not give the advice, right? To let people work things out by asking questions and helping them to sort through their own stuff, and then they come up with their own answers, which is great. But Mary, I know, right? Mary's my baby. I mean, one of 3 babies, but she's my baby, and even though she's an adult, I know. But Mary is a caregiver, and I know she's a caregiver, and that's the way. If I was going to strategize, I know her, and I know she's a caregiver, and she will be okay as long as she knows she's doing a good job caring for people, and she knows there's tragedy out there. It's just during the pandemic, a lot of times you're constrained from giving the kind of care that you would have wanted to give, just because of how stressful it was, how many people were sick, how the resources were all stressed. So knowing that, and knowing that, I guess that would be my strategy.
She's my inspiration.
Mary's my sunshine, my sunshine.